Hello, everyone, and I want to welcome Patti Taylor. She's from Dallas-Fort Worth Hospital Council Foundation, and I'm going to ask her to introduce herself and kind of what her role is, and then we'll get started with their work around a post-sepsis syndrome support group.
Hi, everybody. As Mary Ann said, I am Patti Taylor. I'm the Director of Quality, Patient Safety, and Community Health at the Dallas-Fort Worth Hospital Council Foundation. We are a trade organization that supports any hospital within the 60-mile radius of Dallas, Texas. So to let you know how many hospitals are here, we have 110 members within a 60-mile radius. So a lot of hospitals in our area.
Wow, that's impressive. Yes, so let's get started and take a dive into those post-sepsis syndrome support groups. How did you know this was something you wanted to try to establish?
Sure. Well, I want to give you a little background first. It won't take me long. We started a sepsis committee at the request of the hospitals in 2016. And we started with only 8 members, and now we have over 40 members that show up monthly. Our goal was to educate the public. We want sepsis to be as commonly known as a heart attack with the signs and symptoms. And then we're also educating healthcare workers around best practices. So the idea for the support group came out only a few months ago from one of the members on the sepsis committee. She wanted to start one at her hospital, and that is a very big undertaking to start a support group. So we started investigating, maybe doing it as a region where from the hospital standpoint, they didn't have the whole brunt of running this. And the other good thing is that we are neutral. And so we can represent the region and not just one particular hospital or system and reach more people. So with that, we started investigating, and I could not believe how few support groups are out there for sepsis. So we are on the track to try to get one started here.
That's awesome. So your committee was sort of driving you to look into this and figure out, is it feasible in our world, right?
Definitely. They know it's needed.
Yeah. So who do you feel, or who did you need help from to get started?
The sepsis coordinators at each of the hospitals and/or systems have been instrumental in moving this forward, and will continue to be instrumental because they're going to have to get the buy-in from their hospital to refer the patients that we want to attend the support group.
Interesting. And how do you get how have you been able to get their buy-in and the hospital leadership's buy-in?
I have found one thing about people who work in sepsis: they are very passionate, and the buy-in was easy because they are so passionate about that topic, that disease. And again, with the administrative buy-in, it is the reputation of the hospital council as being that go-to person.
That's great. And do you have any data? Are you thinking about what data you need to collect to see if this is going to be a good thing or make an improvement?
I love data. So yes, we actually continuously analyze the data. We have a very robust, we're very lucky data reservoir here, where all 110 of those hospitals give us their administrative data every month. And so we have over 20 years worth of data that with the ICD-10, I could go back and search anything. Unfortunately, I can't get the PSI-13 sepsis mortality, but our hospitals are providing that to us. So I get it a manual way. So we're looking at all the different sepsis diagnoses, even down to where the person was discharged. Did they go home? Did they go to a nursing home? Did they expire? We really look into the data a lot.
And so who are your target sort of patients for referral? How do you make that decision?
We haven't quite defined it exactly, but We are looking at comorbid conditions, obesity. Those are the patients, the ones who got really sick in the hospital and were able to recover, because they tend to be the ones that are readmitted. We're going to look at readmissions. Who are those? What's our rates? And that's how we're going to determine if we're being successful over time, is did we impact readmission rates? Did we impact the sepsis awareness?
That's awesome. That's really good. And are you using an improvement strategy, or are you still in the developmental phase? Are you gonna use PDSAs, or you lean? And what are your thoughts there?
We're still a little baby steps. I saw one yesterday. It was a crawl, walk, run. We're still in the crawl stage.
Yeah, I totally hear you. I hear you. So as you're looking at this project, and I know you're only in it, how many months since
About 3.
Since the embryonic stage?
Yes, 3 months.
Anything you would, I know it's a short time frame, anything you, looking back, you would do differently? Or have you shifted gears at all as you move forward?
We've shifted a few times because the committee really wanted it to be in person. They felt it was going to be more impactful for your patients, but I brought up some concerns: transportation, availability of a room to get people to come. You'll have to give them food, water. And so we did pivot to virtual. We did decide that was probably the better option, and to be able to attract a wider audience.
Very good, very good. And as you think about this project and this development of a post-sepsis syndrome support group, what is one piece of advice you could share to those who are on the fence?
Well, just ask people. If you ask them, they're going to say it is so needed. And they get discharged from the hospital and they don't know who to turn to or what to do, and they end up back in the emergency room again. So that is one thing. And it's find those passionate people. The sepsis committee has already volunteered, and we're going to start in January of 2024. We already have a sign-up list of which sepsis coordinator is going to lead which session. And we intend on the sessions to be 1 hour long, 30 to 40 minutes of education. And then we really want the support group part of it for about 20 minutes of them talking, sharing stories. The other piece of advice I have, since there's hardly any sepsis support groups out there, I had to think outside the box. I actually used to run a support group for COPD patients. And so I reached out to the American Lung Association and said, can I have your format? How do you train your trainers? What agreements do you have? So even though it has nothing to do with sepsis, they are able to help me figure out how to get this started.
Oh, that's awesome. I would also think the groups that are forming post like PICS support groups, post-intensive care syndrome support groups would be helpful as well. So yeah, that's awesome.
I didn't think of them.
Yeah. Anything else you want to share? Or
just that if you have those passionate people, listen to them. Yeah. They know what is needed. And we're super excited to get into this and just show the community too that the hospitals care even after you've left the hospital.
I imagine this is going to have a huge ripple effect in your area.
We hope so.
Yeah.
I would love to come back next year and give you an update that
that would be awesome.
Successful.
Awesome. Well, any movement forward is success, I think, in this arena.
True.
So that's awesome. Great.